Cancer of any kind is a life-changing event, not only for the patient, but also for the extended family and the loved ones. Apart from the impact that cancer has on the patient's mood, anxiety, questions about longevity, questions about the future for the patient himself or herself, and also the loved ones, colorectal cancer causes particular problems, including profound blood loss in the stool, making the patient anemic, tired, and fatigued. It can cause bowel obstruction, leading to abdominal pain. It can affect one's appetite and lead to profound unintentional weight loss and weakness. What causes colorectal cancer? There are several theories surrounding as to why cancer develops in the colon. The most significant ones are those surrounding family history and presence of previous colon polyps. The BHG guidelines with regards to identifying high-risk groups for colorectal cancer takes these two into consideration. For example, if there's a strong family history of colorectal cancer in the first degree relatives, or if there's been a previous history of polyps, either in the first degree relatives or the patient himself or herself, then it is deemed that they have a higher risk of colorectal cancer. There are certain familial conditions which can predispose to colorectal cancer, and there are some gene testing available for the same. Yet again, having a detailed family history is a big step forward in this aspect. There are other colon conditions like inflammatory bowel disease, which can predispose to colon cancer as well. With regards to colorectal cancer, like any other cancer, having a high index of suspicion and being aware of the red flag symptoms and presentation is key to an early diagnosis. From a patient's point of view, symptoms that need to tick off the alarm bells is new onset abdominal pain, presence of a lump in the tummy, a change in the bowel pattern from what is normal, seeing blood in the stool, having unintentional weight loss are the key symptoms. Once you are aware of these symptoms, and if these do happen, it is absolutely vital that you seek the expert help of a gastroenterologist. When you see a gastroenterologist like me, things that we do include basic blood tests, which will give us some clues. But the gold standard is doing a camera investigation of the large bowel. In technical terms, this is called a colonoscopy, and it's a fiber optic instrument inserted through your back passage and aiming to go all the way around your large bowel, seeing if there's any reason for your symptoms. And the main intention is to identify and rule out the possibility of cancer. Once cancer has been diagnosed, it is absolutely vital that the patient goes through what is called as a staging process. It is to identify or see if the cancer has moved outside the remits of the colonic wall, and whether it has spread to the local lymph glands or whether it has spread to the rest of the body, or in medical terminology, we call it metastasis. To do this, we ask the patient to have a CT scan of the whole body. We then discuss the colonoscopy findings, the patient-related findings, and the CT scan findings in an MDT or a multiple disciplinary team meeting to decide on what is the best way forward. Now, the treatment options could include a combination of colorectal surgery, for which we need to involve a colorectal surgeon to remove either the part involved or the whole of the bowel, depending on the extent of the cancer. Chemotherapy, which is using medications to shrink the size of the cancer. And for this, we involve an oncologist or a cancer specialist. The chemotherapy comes with its own side effects because they are very strong medications. Patients usually complain about hair loss, getting extremely tired and lethargic and weak. It is important to note that in the last 5 to 10 years, chemotherapy has developed really fast, and the medication that is available these days have much lesser side effects than what they had 10 years ago. And patients are able to cope with these chemotherapy drugs much better than before. Chemotherapy is used either before or after the surgery to get better results, or in unfortunate situations where there has been extensive spread of the cancer, it is used for what we call as palliation. So it is to curb or slow down the cancer rather than treat it, to buy the patient valuable time to enjoy with their loved ones. Sometimes radiotherapy is also used to shrink the cancer, and in particular, when colon cancer leads to bowel obstruction. It is absolutely vital that the patient understands that once we start to hit the age of 55 and above, colorectal cancer risk increases. And it is for this reason that the government has initiated or has been running the National Bowel Cancer Screening Program. It was initially targeted for patients above 65, but now it is going to be reduced to 55 to increase the uptake of these patients with cancer and effectively treat them before the cancer gets out of hand. Patients should be aware of the red flag symptoms, which I think I've already mentioned. It is important to understand that treating colorectal cancer needs the expert help of a specialist, and in this case, a gastroenterologist, who will then involve the right other specialists like a colorectal surgeon or a radiologist or a